In this case study, I'm going to talk about heart failure, which is under the topic cardiovascular disorders. Remember that heart failure can be spoken of very generally, but we broke it down in lecture as right heart failure and left heart failure, which are very different. Right heart failure, remember, is also called cor pulmonale, and left heart failure is also called congestive heart failure. Right heart failure is less common than left heart failure. Right heart failure is caused most often by lung disease, whereas left heart failure is most often caused by ischemic heart disease. Right heart failure will lead to peripheral edema, whereas left heart failure can actually lead to right heart failure, which can then lead to peripheral edema. In this case study example, we have a 66-year-old male that has increasing shortness of breath over the last month. Remember, that's dyspnea. He has noticed that his feet and ankles are swollen by the end of the day, so edema. He's been waking up in the middle of the night with acute shortness of breath. You might recall that this is referred to as paroxysmal nocturnal dyspnea, and it is this sensation of shortness of breath that awakens the patient suddenly after they're going to sleep. Additional history includes a transmural anterior wall myocardial infarction 7 years ago. So what this is, or what this means, is that the person had a heart attack, a myocardial infarction, that involved the full thickness, hence transmural, full thickness of the myocardium of the wall. This heart attack led to him needing bypass surgery, so 3-vessel coronary artery bypass surgery. Coronary bypass surgery works to redirect blood around a section of a blocked or partially blocked artery that's in the heart in order to help improve blood flow to the heart muscle, because as we know, the heart receives its blood supply from the coronary arteries. This person has also had hypertension or high blood pressure for really at least 15 years. Oftentimes, once a person is diagnosed, they likely had high blood pressure for a period of time, even before that. So his body has been under a lot of stress, and his heart has been under a lot of stress for quite some time. He also is a smoker. And it wouldn't be surprising if there were other poor lifestyle choices as well, such as being sedentary or maybe having a poor diet that led him to this long history of hypertension and this eventual heart attack. Smoking damages many tissues in the body, including the blood vessels. He reports that after 40 years of smoking that he did quit once his bypass surgery was done, but it is always an important consideration that it is possible that the patient never actually fully quit. They just reduced their quantity of, let's say, cigarettes smoked. Now, having had a heart attack brings us back to our common causes of right versus left heart failure. Ischemic heart disease, which is most certainly what he was experiencing, that progressed and ended up leading to a myocardial infarction, we know causes left heart failure. But at the same time, we know lung disease causes right heart failure, and him being a chronic smoker, it's quite possible that he has lung disease. But in this particular example, what we're looking at is a case of left heart failure caused by ischemic heart disease that has progressed, and as you'll see soon, leads to right heart failure, as we know. Okay, so I want you to think of him as having left heart failure, and we'll look at its progression in a moment. He's currently taking nitroglycerin, metoprolol, and aspirin. Brief information on each. Doctors will prescribe nitroglycerin for angina, for that chest pain. And what nitroglycerin will do is widen the blood vessel within the heart so that more blood can get to the heart muscle. Less blood getting to the heart muscle can cause chest pain. More blood will allow for a reduction in the degree of chest pain that that person is experiencing. Metoprolol is a beta blocker, and it is used for treating angina, chest pain, and hypertension or high blood pressure, which we know he has. Beta blockers will work to reduce blood pressure by blocking the effects of a hormone that you know of called epinephrine, also known as adrenaline. And so this will, when you're blocking these effects, it's going to cause or allow your heart to beat more slowly and with less force, thereby reducing your blood pressure because you're putting less blood volume out into the systemic circulation. And then aspirin is a blood thinner, really antiplatelet to prevent clotting. So this could be taken even preventatively in this case. Okay, physical exam. Blood pressure is normal, and actually it's on the lower end, but remember he's taking blood pressure medication. His respiratory rate is high. Normally we want to see anywhere from 16 to 20, but once you get closer to 25, that becomes more concerning. Why does the person need to breathe this many times per minute to attempt to meet the oxygen demands of their body? And it increases even further when he's just doing minimal activities, so walking to the examination room in this example. So that's obviously concerning. It was noted that there is moderate jugular venous distension, and so we have this image here showing you the jugular vein. Now remember, if the left heart is failing to pump blood appropriately into the systemic circulation, it starts to back up into the left atria and into the lungs. And now this right heart side of the heart is having some resistance now to move blood in the direction it wants to go. And eventually, because of that resistance, it's going to back up, causing the right side of the heart to fail, where it will then move in the opposite direction through the inferior vena cava and the superior vena cava. And when it moves into the superior vena cava, it will back up into the jugular vein, causing it to distend, so it looks like a varicosity. When it backs up into the inferior vena cava, well, that's where we're getting into the venous system throughout the rest of the body, backing up and congesting the liver, backing up into the periphery, causing pitting edema in the feet and the ankles. So what we see here is this evidence of right heart failure, and people with right-sided heart failure have usually already experienced left-sided heart failure, as we've already seen in this example. Another point to make here has to do with the apical pulse. An apical pulse can be measured by listening over the apex of the heart using a stethoscope. So this is the apex of the heart, and it's angled to the left, as we know. But it's displaced laterally, meaning that the person that is trying to listen to the heart knows certain landmarks and is trying to auscultate in around this area, but it's not working. And then they move a little bit more laterally and they can auscultate it. And the reason for that is because the heart has gotten bigger because of the stress that it's been under. And that we know is called cardiomegaly. And an enlarged heart is always pathological. Some important findings on diagnostic testing for this individual include, just skipping down here for a moment, that the chest x-ray showed cardiomegaly, that enlarged heart, but there were also some small pleural effusions. And that's a buildup of excess fluid between the layers of the pleura outside the lung. Remember that we have, from normal anatomy, a visceral and parietal pleura that cover the lungs. And there should be a little bit of fluid within it, but not very much. But when you have excess fluid, it's referred to as pleural effusion. It was also noted that this patient has moderate hyponatremia. Now this is important. If you look at the word hyponatremia, a term you've probably heard of before, hypo means low, and this is referring to sodium, and this is referring to blood. So this is low levels of sodium within the blood. So I want you to think about this. If the left side of the heart is failing to pump enough blood into the systemic circulation, we would say that's low cardiac output. And low cardiac output, low volume of blood in the systemic circulation, will correlate with blood pressure, actually bringing blood pressure down, which also contributes to his lower blood pressure. This drop in cardiac output is associated with this, or triggers this compensatory response in the body that's going to activate several neurohormonal systems that are designed to preserve arterial blood volume and subsequent arterial blood pressure. This state of hyponatremia in patients with heart failure is primarily caused by this increased activity of antidiuretic hormone. And antidiuretic hormone is going to cause the kidneys to get rid of less fluid, meaning that we hold on to more fluid in our blood vessels. More fluid in our blood vessels means more volume, obviously, and more volume is going to correlate with an increase in blood pressure. And so why does this cause hyponatremia? Well, think of it like if I put some salt on the counter and then I pour water on it, it's going to dilute it. And that's sort of like what happens. We have this normal amount of sodium within our blood. And all of a sudden we say to our kidneys, don't get rid of excess fluid. Let's hold on to it in the blood vessels. That excess fluid dilutes the existing sodium within the blood, causing hyponatremia. Another important finding includes hypoalbuminemia. Breaking down this word, hypo means low, albumin, a very important plasma protein that works to maintain fluid within our blood vessels. So albumin is this large protein that should stay within our blood vessels. And when it's in our blood vessels, it encourages fluid to stay with it, just based on really osmosis. Water likes to be where solutes are, such as albumin. And emia refers to blood. Why do we have low albumin in the blood? Well, albumin is a protein that's produced by the liver. So one of the reasons that low albumin will be found in the blood in those suffering from heart failure is because the liver has become congested. So if I go ahead to this diagram here, remember that, let's review, this left heart normally pumps blood, the left ventricle, into the systemic circulation. But if it's failing to pump it out, it's going to back up into the lungs. Then it becomes this resistance that the right side of the heart, this increase in afterload that the right side of the heart, the right ventricle, will have. And as it's trying to push blood through, it will get bigger to try and accommodate that, but eventually fails, and then it starts backing up. And it backs up into the venous system. And so what we would see here is backing up into the liver, congesting the liver, affecting the liver's ability to properly produce albumin, to put the albumin into the blood so that we can retain fluid within our vessels. And if we can't retain fluid within our vessels, the fluid leaves the vessels because there isn't enough albumin there to keep the fluid there. The fluid leaves the vessels and can go really into the tissues, causing edema. And of course, the other reason we would see edema is as it's backing up, the pressure increases so much in the venous system, remembering that the venous system is not designed to be under high amounts of pressure. And all this fluid increases the pressure, we call that hydrostatic pressure, blood hydrostatic pressure, that the fluid is forced out of the vessels. Because it's under so much pressure, it wants to take the path of least resistance and move from an area where it's under high pressure to an area of low pressure, which in this case is outside of the blood vessels. Finally, we have elevated BNP. BNP stands for B-type natriuretic peptide, or BNP. Now, this hormone was originally, just for interest's sake, found as being produced by the brain, and so it originally got the name brain natriuretic peptide. But now it's B-type natriuretic peptide. And the left ventricle of the heart is one of the main organs that make BNP. So when the heart is under stress due to this maybe increased load that it has, like we've talked about already today, your BNP levels will rise. So what your heart muscle cells will do is they'll note that there's a problem and figure that there's way too much pressure caused by too much volume of blood. So they're going to release BNP. And they release BNP to signal your kidneys to get rid of salts and then get rid of water. That's the natri part, salt, and uretic would be getting rid of via the urine. And so if we get rid of salt and then water follows by osmosis, then we're reducing the amounts of volume within our blood vessels and therefore reducing the pressure and the load on the heart. So the body's trying to compensate for this increased stress. All right, that is the end of this lecture. Just to summarize, it is likely that this person began with left heart failure that was due to a myocardial infarction, and then it progressed to right heart failure. Thanks for your time. Bye for now.